welcome back to my YouTube channel.
Today we have something really cool and exciting to share with everyone. It's regarding a new machine that I have just bought, something called a WaterLase. It is a state-of-the-art equipment that is used by some of the best dentists in the world. The technology is all about precision, being pain-free, encouraging healing. I'm using the WaterLase on my patient today that presented with an old crown and 2 old veneers. The veneers and crown were not proportionate to the other teeth. They were very dark in colour, and the crown also had a metal margin. They're about 10 to 15 years old. So we used the WaterLase to begin with. Now, we numbed up the patient first, giving him some local anaesthetic, and then we used the WaterLase to gently go around the margins of the veneers and the teeth to warm up the cement. Sometimes the WaterLase can cause the veneer to pop off, but in this case it just warmed the cement, and then I was able to drill off the veneer much easier than would normally be expected. Once it was all removed, I then prepared the teeth using the Gallop-Garel technique. So with the Gallop-Garel technique, you do depth cut burrs in 3 planes, as you can see here. And then what you do is use a pencil mark just to outline where the tooth needs to be cut. The actual template used was from a wax up, which we inserted on the teeth and then did the depth cut burrs. We also took down the incisal edges, which is the edges of the teeth, to ensure that we had enough space. The preparations of the teeth were refined, and also we decided to do what we call a gingivectomy. Again, the WaterLase was used for this, where we cut a little bit of gum, and as you can see, it's really smooth, it's really slick, it's minimal pain, there is minimal bleeding. In fact, we also helped aid in the bleeding, and we used a different tip which was really fine, just to make sure that the tissues were healing, something called tissue plasty. We prepared the teeth and then took several records. So for example, I placed retraction cord in the gum, so as you can see, placing little bits of cord into the gum, and that moves the tissues out the way so we can take an accurate impression. I take 2 impressions, but I also take a scan because I like to be super accurate. We also record the shade of the teeth with something called an ND shade guide, just to see what the underlying tooth colour looks like. Once that's done, we get the patient to stand up, and we take what we call a coice, which is using this white plate and putting it against the patient's teeth and taking several photographs. We also take a stick bite as well. Once these records are done, the patient is sat back down and we place the temporaries. With the temporaries, we do something called spot etching, which is this blue liquid that you can see. We wash it off. We also use something called Gloomer to help any sensitivity on the teeth. And then what we do is that we place bond. In this case, I use OptiBond FL, and then I use the template from the wax up to place the temporary veneers and crown. I use something called Luxor Temp in there. Once this is removed, the patient can also see how their teeth are going to look, the different shapes, the different sizes. And I take lots of photographs to show my technician the colour of the teeth and what the shapes the teeth should be, and any changes that we need to make. I show the patient how to clean their teeth properly once this is done, and we take a scan of the temporaries so that the technician can copy the shapes that the patient likes. Once this is done, the patient can be on their way and a review visit is booked. But you can see that the whole process is pretty slick, it hasn't been painful, and it's all very systematic and planned and executed properly.